Thank you for inviting me to the Neurology and Dysfunctional Congress, and thank you all for to be here. I'm a physical therapist for 15 years old, and I use manual therapy and segmental stabilizations, movement control for treatment. And in these years, I have a lot of opportunity for treatment in the patients having chronic pain, and I work in the sector in the big institute, the orthopedic in Brazil, and I work in the hospital. I give the opportunity for us coordination the clinical in the hospital, in the big center in São Paulo, and now I have my short clinical in my institute. When I have my dream is start my postgraduate my degree, and I research. I studied about chronic pain, about pain. And I specialize in the big center in São Paulo, and the big center they specialize in the chronic pain in São Paulo. I talking about pain. Pain is the most common in all patients in the health service, and chronic pain is the main cause of disability in the world, reducing quality in the life, and is also responsible for increase the risk for mortality in the population. It's possible to observe the high incidence and increase the mortality in the population because people have chronic pain. Chronic pain is defined as a pain that persistent or recurs for more than 3 months. If you have pain for 3 months, we have chronic pain. Chronic pain can be classified as primary or secondary according to its etiology. Now and today, I talk in specific about primary chronic pain. It's about low back pain. It's about people have fibromyalgia, have people having problems with the change in the nervous systems. Primary chronic pain is associated with nociplastic pain. Nociplastic pain is a typical pain while people have pain because your system for and your sensitivity for pain is a change for nervous systems. It's not because the musculoskeletal system, because the heart, because the other problems. It's a complex system, and people have many factors for have pain. It's possible to observe emotions, problems for emotions, problems for environment, problems for diet, problems for behavior. Is a big context for people who have chronic pain. But I talking about specific situations, and it's possible I'm a physical therapy treatment in the pain. Nociplastic pain is responsible for the excessive activations of cortical areas that correlate with pain regarding tissue. It's associated with evoked pain and alterations the sensitivity. What can expected in the evaluation of this patient? It's very common loss of functional capacity. Functional capacity is a poor prognosis this patient because the primary care for treatment in the chronic pain now is a change of behavior, is a start the activities, the physical activities, change the diet, but people can't good movement because people have pain. And I talking about this, about what you introducing this treatment for people having a good treatment in the pain, for people having a possibility for changing the habits, for changing your behavior, for introducing the activities in your life, and improving the quality of the life. The improvement of the functional capacity can be an important factor in the treatment of chronic pain. Manual therapy is the oldest therapeutic resource. The manual therapy in pain management and interrogative review is my first article. Because I used along this time manual therapy, my scientific question is, what is the evidence for people in improvement the people management the pain for using manual therapy. And I observed the literature and high numbers for articles and good evidences for treatment the pain when people use manual therapy. And what it's possible you change in the people for you when you use manual therapy. The literature shows changes in the central nervous systems after applications of the manual therapy. This can lead to an improvement in kinesiophobia, with an improvement in evoked pain. Improvement of blood flow through excitation of the automatic nervous systems. Automatic nervous system is the most important control and equilibrium, because people have pain, people have a high activator for sympathetic system, because people having a high sensibility, and your nervous system changing for people, and all these days, every time, having automatic changing automatic disorders for automatic nervous systems. And in manual therapy, it's possible your control and your automatic nervous systems for people having a loss level of the pain, a loss level of sympathetic to neural automatic system. Decrease concentrations for the inflammatory biomarker interleukin 1b. Interleukin 1b is associated with chronic pain, and when people having a lot biomarker, people having a lot pain is associated. If you people decrease inflammatory biomarker, it's possible you understand people have getting better this pain. But how to use and select manual techniques? I observed a lot, many studies, and people observed situations on the point, manual therapy, and specific point, and people have pain. But observe this study. These actors observed the techniques for diaphragmatic muscle for treatment in the low back. It's not technique specific in the low back, it's technical in other place, other locations in the body, for getting better the movement, for getting better the capacity, the functional, and getting better the pain. Improving the functional capacity, because these articles demonstrate and the soft tissues manual technique release, it's possible people getting better your movement, reduce your motion control. These articles demonstrate the follow-up of the 8 years, demonstrate improving the quality of the light and pain when compared to orthopedic treatment. For me, the treatment, the pain is a multifactorial. People need go to the doctor, people need to go to the nurse, people need to go to the diversified sectors in the health. But it's important, the primary care reduce the cost for people living and people it's possible treatment and effective treatment and the fast. The problem for the world is a cost for treatment. A lot of people don't have good treatment because don't have research for treatment. Multimodal treatment for a better result. It is extremely difficult to perform exercise with patients with pain. These articles demonstrate individuals with pain having a less adherence to exercise. Exercise is most important for people having chronic pain. It's a primary care for treatment in these people, but people can't exercise because people have pain. People need the best treatment for the pain, need to start other treatments for now begin people having less level for the pain and start exercise. It's necessary to reduce the level of the pain before starting the exercise. These articles demonstrate the treatment for movement stabilizer in the first sessions don't have a good experience for the patients, don't have a good improvement depend, and it demonstrates people having other treatments for introduce the treatment. Motor output is high adaptable, can be influenced by multiple mechanics, is various levels of along the nervous systems, and may vary between individuals despite similar diagnosis. Evaluations of the abdominal transverse muscles in individuals with low back pain, a literature review for it's my second article. When I research in the literature, what is changing for motor control for the muscles with people have pain. And my question, my scientific questions is what transverse abdominals changing in people have low back pain. And I observed a lot of situations and different situations when people having low back pain in this muscle. The motor control treatment model. Observe this picture. Is different types of strategies people having pain. And people have pain, it's possible facilitation or it's possible imitation. People have a high contraction in your muscle or people have a loss contraction in your muscle. You need evaluations and individual treatment for your good strategy for treatment these people. Manual tabs should be introduced in the first sessions until the patient is able to perform a motor control exercise. It is I use it every day, and is a possible for treatment, for best treatment in the people have pain. Is my hypothesis. This exercise should be directed toward functional activities, enabling the practice of the physical activities. Pain education, because people a lot physical therapists and manual therapists using manual therapies and talking about these patients with manual therapy as a solution for treatment is not true, because manual therapy is good treatment in the first sessions. And along the time, people need don't have a passive treatment. People need good self-treatment. People understand your situation, understand you need movement every day, you need diet well, you need sleeping well, you need practicing exercise. Is a pain education is very most important for this patient. And the therapeutic need good communication for explain the situation, explain the first and the started treatment I use in manual therapy, and the next I use in motor control for introduce your movement for your understand what strategy you use and change your strategy for good strategy for your having a good movement. And next time you don't use manual therapy, you don't use movement control, you're using what physical activities you like. You're changing your behavior, you're introducing physical activities in your life. And the other treatment is very important for the context this treatment. Thank you very much. Any questions? And if you don't understand me, please, and any question, please.